Next up, we're excited to present a fireside chat featuring Jesse Bishop, Enterprise Account Executive with Dataiku, and Mike Berger, VP, Chief Data and Analytics Officer, and VP, Enterprise Data Science Center of Excellence for Mount Sinai Health System. Get ready for a really great discussion. We're glad to have you both with us today. Jesse and Mike, over to you.
Hey, how's it going, Mike?
Good, Jesse.
Good. So hello, everybody. Welcome to the Fireside Chat. My name is Jesse Bishop. I'm an account executive from Dataiku, also a data scientist by trade. I wanted to really introduce my friend and my partner in analytics, Mike Berger. Mike, did you want to say hello?
Hi, folks. Mike Berger. I have a couple different roles at Mount Sinai, where I'm the Chief Data and Analytics Officer. Mount Sinai is a health system here in the New York metro area. I run a couple of population health analytics and data science teams, as well as run our enterprise data services.
Very good. Yeah, so we've been working together as partners between Dataiku and Mount Sinai for a couple of years now. But I was wondering if you could tell the audience a little bit about how you started. What was your journey like to get started in self-service analytics? What were your drivers and kind of what was your strategy?
I wish I could talk about that journey completely in the past tense, but it's definitely something we're still on as we're speaking here. Our drivers were simple. I would say it was about survival. If we don't learn how to compete on data, someone else will, and they're just going to eat our lunch. So our approach with that sense of urgency has been, okay, let's look at the entire end-to-end process of how data becomes something that we use to make better decisions, to produce information, and somewhere in the middle. So we think about it in terms of supply and demand. If we can improve the supply side of data, better quality, better searchability, better metadata, catalogs, just better tools in general. And then at the same time, focus on the demand side, help people learn the art of the possible. What is data science? What is big data? What is predictive modeling? What's real? What's hype? And then have a respect for what it can do, how it can help solve problems. And the idea being, if we can teach people how to be better customers of analytics, that will give our data scientists, our analysts, better more demand for their services, coupled with better data, better tools, and we'll get ourselves into a nice virtuous cycle. And that's really our approach.
Yeah, Mike, I really like thinking of it as a supply and demand issue, for the journey towards advanced analytics. I have an economics background, actually, so that's really speaking my language. But yeah, so I think that's a really good way to think about a couple of the big challenges of getting started, the supply side and the demand side. So how did you approach the supply side?
We're as an industrial engineer, we put process flow diagrams together, we swim lane, we look for inefficiencies, and there are plenty, like a lot of other organizations, a lot of fragmented silos of data, a lot of replication. So different groups using the same data, but going and replicating it, applying the same level of management and engineering and prep time. So there was no kind of efficient, well, if somebody's going to do it once, can we reuse it other places? So it's really clear that was just missing. So where we can, we've started to try to bring that better together in the same way that, Johnson & Johnson thinks about its supply chain and consolidating its suppliers, getting more and more information, making sure it's really efficient and single-threaded. And that's really how we've approached the supply side of data.
Oh, very cool. I think that's very important stuff, is where's the data coming from? How do we break down some of those silos where the data might live and who's managing it? And I think getting that access is a fundamental part. And that's something that you've had success with at the hospital. And what about the demand side? I think we've talked about data literacy, understanding what the analytics means and how it can be relevant to business. And even things like increasing adoption. We might have great models, but are they actually being used? Can you tell us a little bit more about that?
Yeah, I mean, there's quite a bit to unpack there. At the most basic level, there is literacy, data literacy. I mentioned just understanding the art of the possible, trying to get, all the way up to the executives to really understand, what AI is, what it isn't, what can be useful in the space of healthcare. Unlike a lot of other industries, just doing diagnostics with AI has a lot of implications. When you're talking about patient safety, you're talking about decisions that the care team is making. There's a lot of overhead to that, and we want that to go through the research arm, the clinical trial arm, and in some cases getting FDA approval. So that's the slow part of where AI adoption is happening, but it's the scale, that the potential is massive. So certainly a lot of investments there. But what's been really a big part of our journey is not how to better diagnose or how to more quickly diagnose or, trying to automate, let's say, the work of a clinician, which is just very challenging. It's more about efficiencies. Can we improve how we process our invoices? Can we improve how we process claims or respond to denials? Can we think about how we schedule and optimize? Can we predict what volume is going to be like? Can we predict when patients are likely going to get discharged so that we can figure out how to make beds available? So these sort of efficiency questions are really what we're trying to get our leaders to start asking. And, really, if we can start telling them, hey, this is what's going to happen tomorrow or next week or next month, it really changes the way they make decisions, the way they use resources. And that's the great enablement we're trying to achieve in the short term.
Sure. I think that makes a lot of sense. I mean, you touched on some really high value applications. You also touched on some of the challenges that you might face, particularly in the healthcare space, right? So you mentioned FDA approvals, maybe, some patient sensitive outcomes, right? So one of my questions was going to be, how do you see some specific challenges in the healthcare space? So I think you touched on that a little bit, but do you want to expand a bit on how you see, particular challenges and maybe opportunities in healthcare?
Yeah, I mean, it's just sort of drilling into what I was describing before. The best analogy I think a clinician ever gave me was, they think in terms of three levels of confidence. There is 100% confidence, there's 99% confidence, and then there's everything else. And so if you've got a great model and it produces 98.5% accuracy, as a patient, I guess I don't mind that my doctor thinks that's actually not good enough. And so they're still going to maybe order a test, maybe get a second opinion, maybe trust a little bit of their intuition on top of what the data is saying. And that's challenging. It's challenging. It's pretty hard to find a lot of data science models that are achieving 99% or better. And so managing expectations is a big part. And then, as I was saying, focus on efficiency, focus on things that don't need the same clinical rigor as clinical diagnostics. So, we've got some white papers out there. We do predictive modeling around, what order do we call patients when we're worried about them potentially having acute issues. We think about how do we organize our dietitians to do rounding through the hospital based on which patients are most likely to have malnutrition needs. And there are other similar concepts that we can use all of the rich clinical data, all of the device data that we have, whether that's in the hospital setting or even more and more, we're getting remote patient monitoring data so that we can see how our riskier patients are doing outside. And the idea is to bring that in and then help us stratify, help us segment, help us cluster, and then really, operationalize how we engage with them.
Right. I think that makes sense. So finding, I like the analogy of the 199 and everything else, so clearly there's going to be some applications throughout the hospital that are going to need that 99 or 100%, right? So it sounds like your strategy is to find some of the lower barriers to entry, right, where we're not as, maybe clinically focused on that level of accuracy and get wins, and then build on those wins to, is that a way to evangelize analytics throughout the organization?
Yeah, I mean, that's exactly right. It's, we think about it in terms of organizational readiness. Where is the organization ready to use that? And in a lot of cases, I think we see a lot on the imaging side. You get, you see commercials on TV for, Big Blue and other companies that are claiming to do great imaging-based deep learning, and it's phenomenal. The future is definitely here, but those have a really long run out, a really long time to get really perfected, to go through FDA approval, to get deployed, operationalized into the medical records so that it actually becomes part of the data-driven decision-making process. So, in terms of organizational readiness, those aren't the good wins. Those aren't the quick wins. The future, but maybe the future just isn't quite here yet in those areas. So we, like I said, focus on efficiencies, focus on optimization, focus on RPA in technologies now that are becoming more commoditized, so that we can, to be honest, it's create more bandwidth within the organization to be able to do more innovative things by taking advantage of some of this native capabilities.
I think that makes sense. So organizational readiness, within the hospital, and finding those places that are going to be most receptive right now and building from there. And within that, I know that we've talked about some great wins that, some of the teams applying data science and advanced analytics have gotten. I wondered if you wanted to talk about, how do you measure the ROI from some of these efforts? What is a win in from your desk?
Yeah, I mean, so it starts with, changing the mindset from, build it, they will come, into, okay, let's find really specific business problems and get aligned to them, help solve real business problems. And if we can align the KPIs of analytics with the KPIs of the business, then, if the business is killing it, then that must mean we're killing it too. And it becomes really easy to start comparing and getting credit where credit is due. So that's been a big part of it in turning down projects that sound very cool, maybe even sound very glamorous, but they're not really well aligned to business problems. So that's kind of the first big step. And then, building operating metrics, data science. It's not usually about somebody is in one system and then they're going to just remember, oh, let me go over to this other system and run a model on this patient data and re-enter everything. The goal is to have everything in one place. And that's really an optimized deployment. And so that's always our goal. That's how we know that something can get used. And then once it's in that system, we can start to measure, how much is it used? How often does the care team member or the scheduler or whoever it is that we're augmenting their decision, how often are they agreeing? How often are they disagreeing with our suggested whatever, whether it was a suspected condition or advice around how many people to bring in? If we can measure the acceptance and the rejection, then we can start to understand, well, what's wrong with our model? Is there something about the time of day? Is there something about things that the decision maker is seeing that we're not capturing in the data that would make our model better? And so that helps us get to that, continuously improved, high performing feedback loop.
Yeah, I think that makes sense. And so it's first about the KPIs for analytics are the same as the business KPIs, right? And I think that is an important thing to think about. And that's, at a vision setting point of view, right? How are we going to align the strategy of analytics to the actual KPIs of the business? And so that is something that I've seen just, across many of the companies that I've worked with, that can be difficult to reconcile because a data scientist, like you said, might want to work on a really cool problem. There might be something that we've got maybe a data first approach. Oh, we've got the data to answer this question. So let's tackle it. But I think what you're saying is we've got to have discipline around focusing those efforts on projects that deliver business ROI and business KPIs. So how do you get that alignment with the actual data science teams?
I mean, going back to the point about organizational readiness, it's having good governance, having, maybe the business paying for data scientists, whether they're centralized or embedded in those teams. If they're part of those teams, if they're funded by those teams, if they are hearing what are the business problems and able to engage with stakeholders, then the likelihood of success is much higher. For sure, there's some risk to this. We definitely have chosen some projects over the years where we're kind of scratching our head halfway through it, and we're like, oh man, we're not getting an output that is good enough to really help the business. Let's stop. Let's cut our losses and go back to the drawing board and see if there's a better way that we can help the business. It's that, sort of willingness to not call this an academic exercise, but an actual business value creation. That's really where, we see our place. And I think that's how we hire folks. That's how we incentivize, and that's how we are able to stay well aligned. Certainly not perfect, but there's a willingness to try things, experiment, hopefully fail fast. But if it's a highly academic exercise, a lot of times you just don't know when you failed. And so having great alignment to the business is important, just to check in regularly.
Right. I think that gets to your second point also. We mentioned, how do you measure our ROI? One was just business KPIs. The other was essentially adoption metrics, right? Are people finding this in one place? Are business people using the output of our model? And that's another place where I've seen, even in my career as a data scientist, oftentimes I'd come up with a great model. I thought it was awesome. I'm getting a great area under the ROC curve. And just the business stakeholders are kind of, okay, whatever, I'm going to keep doing it my way, right? So I think it makes a lot of sense from a leadership point of view to have alignment and to be keeping track of, are these models getting used? Is this just an academic exercise or not? So on those kind of metrics, right, on adoption, how has that been? I mean, I think you mentioned that one major thing is centralizing the interaction with the model, right? Not having to go to a separate place, keeping it in line with business processes that are already there. Are there any other things that you've seen are helpful in getting that adoption from the business?
I mean, it doesn't all have to be, adoption of predictive models. Just analytics in general. Are we building dashboards that are getting used? Are we getting dashboards that are contributing to the value in the decision-making across the organization? Whether those are, transactional decisions or larger business decisions, I think the scale of how we can measure the value that analytics is bringing are far more than just, okay, is this predictive model getting used or not? But that concept is scaled essentially. So we do run analytics on analytics. We are measuring, how often our dashboards used, and that helps us better understand, which ones are getting used, who are the ones that built them, and then who are the ones that we built them for. That helps us know, who are the people that are building maybe more usable dashboards, as well as maybe who are the people who are asking us for work and then never really utilizing it, which is another, challenge in healthcare with just such limited resources. We just don't have the bandwidth to support all the people who might be shopping for data, and they'll go to 2 or 3 different teams, ask for the same thing, and they're just waiting until the data tells them what their intuition already said or was thinking. And that's something we're trying to learn, is which of our customers, needs more education, needs more handholding, and we need to make sure that we're not duplicating work.
Right. Well, we don't want to, I like that idea of going to 2 or 3 different teams until I get the answer that I already thought was I was going to get. I mean, that's for sure. That kind of, something that we see a lot, just kind of shopping for the right answer, confirmation bias, essentially. But I think what you were talking about, the analytics on analytics, right? That seems to tie into that iterative process that you were talking about. What's working, what isn't. Let's iterate rapidly and get to the answer that's going to have the most value so that we can build off that going forward, right?
Yeah, that's exactly right. Going back to the supply side versus demand side that we talked about at the beginning here, it starts with a good architecture. And what you want is an architecture where data can continue to improve over time in a sort of single-threaded fashion. So as people further upstream improve the quality of data to do their modeling or their analytics, that any value that they've added to the data is brought into the hub, is brought into that single thread. So everybody else downstream gets the benefit of that. That has to be, this concept of crowdsourcing for better data value has to be architected into the process. And then, analytics is essentially becomes an extension of that. It's this ability to make the data better and further along so that analysts are really just focused on building analytics. And that's when they can really shine. That's working to the top of their license. And so it starts with a good supply side. We talked about how we contribute on the demand side by helping with the literacy and helping with the understanding and the handholding. And then in the middle, the real rub comes from, helping analysts be more efficient. We have, wide variety of skill levels. And so helping people who are at the more junior end or just newer end, helping them get better, faster with tools that can accelerate their ability to work with larger data sets, do more complex functions. That's just a huge part of our data strategy in trying to, crowdsource, sort of move up the full population of the analytics community at the organization, so that they're delivering more value.
Yeah, absolutely. I mean, and that's something that you and I have worked on together, using Dataiku as a platform for that upskilling, at the hospital. And I think that's something that is really important. And you mentioned earlier, resource constraints. Right? We can't just go out and hire an army of data scientists, with PhDs to run all these models. So I think you're talking about how do we upskill and empower, people throughout the organization of various skill levels to contribute, and to how do we get them to essentially act as, that empower them to be a part of that process, which can be, frankly, pretty exclusionary. So that is something that we've used Dataiku together to help, enable people of all skill levels to contribute and to be a part of moving this process forward. So I think that's great. And I guess we just wanted to wrap up by asking, what's next? You mentioned that your journey in analytics is not done. Yeah, you're right in the middle. So, some closing thoughts on what's next at Mount Sinai?
Yeah, I mean, I don't know if middle is even the right word. We're still relatively early compared to where we want to be, but it's, for us, it's more centralized data services, cataloging, governance, glossaries, just making the data easier to use for the analytics community. So more metadata, more lineage, searchable libraries of all of the great analytics and reports and predictive models that are getting built, with this ability to see who built it, what it was for, so that any employee could request, they could search this library, they could potentially request access, they can learn a little bit about what this is before they bother anybody requesting access. The hope is to try to push towards self-service, and you don't do that in one step. You've got to create the tools. The other big part is building out a data help desk, so people aren't as intimidated. There's a place to go. There is the potential for handholding. And it's not that we have to produce all the reports for the whole organization. That there's a lot of those groups that already exist. But the idea is to be able to bring them together, to triage, to leverage what already exists, and then focus on where we can integrate data better. And so, the end state of this is enabling more self-service. So any employee in the company, any leader in the company, any decision maker in the company has a place to go to ask for data, to be able to better interpret what they can and can't do with that information, and then hopefully to drive better decisions and connect experts within the organization across these different fragmented groups. That's really the next year to 2 years for us is improving the quality of the piping, leveraging cloud, and getting more folks to be more self-reliant.
I think that's a very great goal, and it's something that not a lot of people are there. You're making great progress towards that. I mean, just identifying that as the goal, right? To have people throughout the organization be empowered to make better decisions with data and to use that to its fullest capacity. I think that is really an ideal state. It's something that a lot of people are working towards, and it's a great goal to have. So, thank you very much. Really appreciate it. I think we're probably at our time. So, Stephanie, we can turn it back to you.
Thanks, Jesse.